Welcome back to the Surgical Pioneering Podcast, the platform where we break down the most innovative clinical, surgical, and therapeutic technologies reshaping patient care today. I'm your host, Dr. Reza Lankarani, General Surgeon, Editorial Board Member at the Genesis Journal of Surgery and Medicine, and Surgical Consultant for AIGENELAB. If you're joining us today, you know our focus is always on the frontier of evidence-based practice. Today, we're taking a deep dive into a non-invasive modality that has gained massive traction across both orthopedic recovery and pelvic floor rehabilitation: Pulsed Electromagnetic Therapy, PEMT, and High-Intensity Focused Electromagnetic HIFEM technology. Are these therapies true clinical breakthroughs, or are we looking at short-term management tools? Let's dissect the latest literature. Let's start with a condition that every surgeon and primary care clinician battles daily: chronic low back pain. A landmark double-blind placebo-controlled trial led by Dr. Lee and colleagues evaluated the efficacy of pulsed electromagnetic therapy using a high-intensity device, specifically 1.3 to 2.1 Tesla operating at low frequencies between 5 and 10 Hertz. Patients underwent 15-minute sessions 3 times a week for 3 weeks. The results? Patients in the active PEMT cohort demonstrated a 38% reduction in pain on the numerical rating scale at 4 weeks post-treatment, compared to just 22% in the placebo arm. Disability scores on the revised Oswestry Index dropped by 28% in the treatment group versus a mere 8% in the sham group. What makes this compelling from a surgical perspective is the biological mechanism. We aren't talking about thermal tissue alteration, we are seeing neural depolarization that attenuates nociceptive pathways and mitigates localized inflammatory cascades. Now, let's pivot to functional restorative surgery and pelvic medicine. Urinary incontinence, specifically urgency urinary incontinence, UUI, presents a massive quality of life challenge. 2 key studies give us a clear picture of where magnetic stimulation fits here. First, a prospective 2-to-1 randomized sham-controlled study by Lucanovi and team published in 2026 evaluated functional magnetic stimulation using up to 3 Tesla power over 6 weeks. The active treatment group achieved a statistically significant drop in ICI-UISF scores, improving by over 4 points compared to just 1.19 points in the sham group. They also saw significant reductions in 3-day leaks and nocturia. Building on this, a comprehensive systematic review and meta-analysis by Leonardo and colleagues in 2025 reviewed high-intensity focused electromagnetic therapy, HIFEM. Aggregating data across multiple RCTs, they confirmed a significant mean reduction in leak episodes and overall symptom severity. However, here is the crucial clinical takeaway that Leonardo's meta-analysis highlighted. While subjective quality of life and incontinence scores improved dramatically, objective measurements of resting pelvic muscle tone showed no statistically significant structural change. So, how do we synthesize these findings as clinicians, surgeons, and innovators? The data confirms that electromagnetic modalities excel at neuromodulation. They offer an extraordinarily safe, non-invasive option with virtually 0 reported adverse events across all 3 studies. For patients who are poor surgical candidates or those seeking non-pharmacological relief, this technology is invaluable. But, and here is the critical caveat, we must manage long-term expectations. Because these electromagnetic fields drive neural re-education rather than structural tissue hypertrophy, the clinical gains hit a plateau around 3 to 6 months post-treatment. Longitudinal data shows that without maintenance sessions or active physical rehabilitation, the neuromodulatory benefits fade over time. Electromagnetic therapy should not be sold to patients as a permanent single-course cure. Instead, we must view it as a high-powered bridge therapy, a tool to dampen pain and restore neural firing so that patients can successfully engage in long-term physical therapy and structural restoration. That wraps up today's breakdown on the Surgical Pioneering Podcast. Non-invasive electromagnetic therapy is proving to be a powerful asset in our toolkit, provided we deploy it with realistic, evidence-backed protocols. I'm Dr. Reza Lankarani. Thank you for tuning in. Don't forget to subscribe to the podcast, check out our latest publications in the Genesis Journal of Surgery and Medicine, and stay connected with our ongoing clinical developments at AIGENELAB. Until next time, keep pushing the boundaries of modern medicine. Stay sharp, stay curious.